Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Shelly Davis. Shelly's in our thyroid program, and she's been in approximately 6-7 weeks. And why don't you just kind of talk about how you were and the struggles you went before you even came in, the symptoms you had, everything that you tried, the frustrations, and then you can talk about, when we did the examination and the lab work and stuff.
I've probably had the symptom of irritable bowel syndrome for over 35 years. And, I knew there were a couple of foods that gave me issues, but I didn't really know what was causing the problem. I've been to gastroenterologist. I've had some scopes. They never found anything wrong there. I've also had arthritis pretty severely. I've had 2 knee replacements, and so that's been a continual process of getting just worse and worse in the joints.
So as far as your mobility goes, I mean, even your back, you were having trouble with your back when you came in too. So the whole thing culminated where you're just having a hard time moving around, right?
Yes. I've suffered from migraines. I've had the fatigue, and I've had my regular MD check me several times for thyroid functioning, and of course they never found anything wrong. But now we've done these tests that you've done, and it's been so much more extensive that we've found what kind of foods I need to eliminate from my diet permanently. And I'm telling you, I've already lost 12 pounds, and my joint pain is literally gone. I have not had any issues with my feet, my knees, or my hands for the most part.
Well, you remember when you first came in and we were talking about chronic disease, that they all have one thing in common, which is inflammation. And there's 3 possible sources in your case. There was a neuromusculoskeletal, which is the joints, the arthritis, and then there was a neurological, which was the cerebellum wasn't firing. Remember how bad your balance was and how your coordination was off. And then there's the metabolic, which is all the forms you filled out, which let us know what lab tests to do on you. And so really, if you look at the reason you're doing better is because we're working on all 3 forms of inflammation. And if you compare this treatment just in the 6 or 7 weeks to what you've done on all the other doctors, you've never had any kind of results like this.
No, and the irritable bowel syndrome has greatly improved.
And we've only worked on that for 3 weeks.
Yes.
So I mean, it's going to get even better. Now, what about, and you're starting to lose weight, what about, anything else like the sleeping, the cold hands? I know it's a little early yet, the hair loss, I mean, anything like that, have you seen any improvement in that?
The sleep has been improving slowly but surely.
So what do you mean by that? It's improving?
Well, I have been on a sleep apnea machine.
Okay.
But recently I've kind of gotten off of that a little bit, and the sleep that I have been getting without it has been just as restorative sleep to me as
when you were on.
As when I was on.
Okay, good.
So.
And that's, because you have been on the oxygen and the cerebellum stuff for about 7 weeks now, so that's just going to keep getting better. What about, you said you had chronic fatigue. What's your energy level like?
It's been much improved.
Okay.
Yes, I have been real pleased with that aspect also.
And you've tried for a long time to lose weight, and
very long
can you kind of talk about, the diet that you're on now, which is based on all the labs that we've done. So it's not, we're not guessing. We know exactly what your triggers are and stuff. But talk about how you're not really starving yourself. You're just eating the good food that you're allowed to eat.
I am eating differently. I've eliminated the foods that we found on my tests that were the cross-reactive foods or the wheat gluten intolerance, and it's made an amazing difference in my whole system. Just really, again, I think that's what's improved the joint pain, and it's lessened the inflammation. But I have to say, I was very surprised at the results of those tests, because I would have never thought and trying to figure out what was causing the problem food-wise, I could never tell what it was. I mean, I had an idea of one or two things, but when those test results came back, it opened up a whole new world to me of what I needed to eliminate out of my diet.
Well, and plus, it was probably frustrating to you before, thinking, I think it might be this, I think it might be that. So we did the genetic testing on you, we found out what that was, but we also did the cross-reacting foods. And I told you, you know, we've been taking care of thyroid patients, you know, for over 5 years, and no one has had as many cross-reacting foods as you, and they're the healthy foods. Her genetic makeup cross-react and cause inflammation. We talked about that just a second ago. But 1 teaspoon of any of those cross-reacting foods, gluten or anything that tested on you that was, you know, inflammatory, just a teaspoon of that causes brain and gut inflammation for 30 days. And so by avoiding those, that's why you're starting to heal. But the foods, it makes it a lot more, I guess, easy to commit to not eating those foods, because you know we've done a genetic test on you. We're not guessing, we're thinking, well, maybe it's corn or this. And that's, I think, what helps the patients commit to it.
We talked about that because, you know, if you think you know what it is, you go off of that for a while and you don't really get better, then you think, why even bother? So yes, it's made a big difference. It's made me be able to commit to the foods that I do need to eat and stay away from those that I need to stay away from. And I'm not starving. You just learn to be creative too.
Right.
And of course you have to really read labels, because there's very hidden things in a lot of foods out there that
well, like, what are some of the things that you found? You know, like I think we talked about, there was like gluten dust in something, and you know, we were talking about the cross-reacting foods, but we're talking about, you know, you can go into a restaurant and eat gluten-free, but if they're preparing on the same surface, and that's why we give you that supplement to help with that, to help with the inflammation. But there are a lot of things in the labels that you think, you know, that might be, you know, healthy or don't have certain things in, but you have a list now from your test, and these things cannot be in there. You can eat them. So it's helped you to manage your diet. Okay,
yeah, one of the surprises for me was sesame is one of my cross-reactive foods, and I would have never thought sesame, which is also called tahini, was in hummus. I would have never, you know, you think of hummus as being this really good food, healthy, and yet that sesame's in there, and I'm going to have to learn to make my own hummus.
Right, without, it's not really that tough. We have a little bit, and you know, I think that you can see now that you're starting to feel good, and you know that those other foods were causing trouble for you. So you're the point now. Remember, I told you, most patients say, I'm starting to feel so good, I would never eat that again.
Why would I ever do that again? Exactly.
Yeah. Okay, good. Yes. All right, well, you're doing fantastic. You're just in the beginning of the program, but we're already getting results, which helps you, you know, to follow through and finish up. But we'll check with you, you know, in a month or two, see how we're doing and kind of chart your progress, okay? But I'm excited about taking care of it.
I am too.
All right, thanks.